Brain Anatomy, Part 1. In anatomical position, the orientation is based on three planes, as transverse plane, sagittal plane, and coronal plane. Here the cat is anterior to the man, and the man is posterior to the cat. And now, the bird is superior to the man, and the man is inferior to the bird. Here, his thumb is lateral, and his little finger is medial to his body. Also, his hand is distal, and his shoulder is proximal to his body.
I am in front of him and I have an anterior view of him.
I am behind him, and I have a posterior view of him.
And I have a lateral view of him, can see his ear canal.
This is a lateral view of the brain. There are many grooves in the brain, we call them sulcus. This one is called lateral sulcus. This one is the central sulcus. Between two sulci, we have gyrus, which is a ridge. The lateral and central sulci are anatomical landmarks. Frontal lobe is anterior to central sulcus, and superior to lateral sulcus. Occipital lobe is the posterior part of the brain. Parietal lobe is posterior to central sulcus, and temporal lobe is inferior to lateral sulcus. Frontal lobe controlling movement and executive functions in making decisions. The parietal lobe processes sensory information. The temporal lobe plays a role in smell and hearing. Finally, the occipital lobe, which is responsible for vision. Our brain has two hemispheres, which is divided by a deep groove, known as longitudinal fissure.